So good evening, everyone. Welcome to our update on a return to teaching and learning for the 2020-21 school year. So kind of looking where we're at right now as of 1/26/21 in Oakland County when it comes to the vaccine. Total doses so far, 146,500. So we've seen a pretty good increase over the last time we had a report on this. We're starting to see the rollout of the Moderna vaccine a little bit more. Also, based on what the governor said last night and checking to see what the federal government might be able to do, it looks like there's a chance for the next 3 weeks the state of Michigan is going to get a 16% increase in vaccines. If that holds up and that is accurate, that should open up the door for more people in 1B, in particular our teachers, to get additional shots. We've also been working with Phil Liberty and the BHEA union. As our teachers sign up to go and get the vaccine when the spots are available, we're making sure that there's no constraints for them to be able to go as far as scheduling the time. So if it's during the workday or right before school or right after, we're doing everything we can to make sure they're able to go so that they don't have to worry about finding a certain time, just to sign up for the time that's going to be open. Next slide. Looking at the weekly COVID-19 report from Oakland County Health Division. Overall, there are 645 fewer cases in Oakland County when compared to a week ago. Our age group of 0 to 4 and 10 to 13 were pretty much the same within a couple numbers compared to last week, but all the other trends are continuing to move down in the right direction. Next slide, David. Hospitalization. This is something I get a lot of emails about from parents, why we include it. This is one of the #1 factors is hospitalizations and hospital capacity when dealing with COVID. So the trend continues to move in a positive direction. We're seeing fewer patients in critical care, fewer patients that are on ventilators. And so those are all good signs at the moment. Next slide. So looking on a national level, can you go back one, David? I guess we skipped one. All right. We're good. Keep it here. So again, looking at Oakland County, looking at the new cases per 100,000, we've had 33 days in orange, and we're getting close to the yellow mark as well. Looking at percent positive, that continues to go down a little bit slower. We've had 36 days in orange. It's good to see both trends continuing down. So we're right about where we were early to mid-October when the COVID numbers were pretty good. Next slide. So looking at where we're at on a national level, we peaked about 250 to 260,000 COVID-19 confirmed cases daily. Right now, we're about 160, 170,000 per day range, which is still higher than where we would like to be as a nation. But again, looking at that continued trend that the COVID numbers continue to improve week by week. Next slide. So going back to Oakland County, top right, counts by day. Right now, Oakland County is averaging about 200 cases per day. When we had that large spike, some of the numbers were well into 1,300 per day. We'll keep track. This is updated now. When this is updated, it's on a little bit of a lag as well. So when you look at the data at the top for the 28th and you see 49, it's not going to be 49 for the 28th for today. Check back tomorrow, check back the next 3 days. They've now started accounting for that lag. So understand it's going to be probably 3 to 4 days for the accurate number to be translated onto this website. It also breaks it out a little differently by age group. And then you can see the chart for a 7-day average of daily cases. We had the spike in November and December, came back down, went up a little bit again after that. We're continuing on that downward spiral right now. Next slide. Thank you.